So if you don't know who I am, my name is Dr. Dave Boynton. I'm a chiropractor. I specialize in functional medicine. This is my office, so thank you for coming. So we're talking about a topic that's very near and dear to pretty much every adult's heart, and that's breast health, because all of us know someone who's had breast cancer, or you've had breast cancer yourself or someone in your family. So this is something that we all need to be aware of, and really we need to be aware of it from a standpoint of your whole life. So I want to talk about some functional medicine stuff and some of the basic things you need to understand, and then we have some other very talented women who are going to be talking about thermography, some muscle testing, and ways to evaluate the body in different ways. So we're going to go ahead and get started here. So this is kind of what we're going to be talking about. So what should you know and be concerned about as far as your breast health? Some signs and symptoms associated with poor breast health. Can you improve your breast health? Yes. What do your teeth have to do with your boobs? What are endocrine disruptors? Inflammation, why is it bad for you, and what can you do? So if I talk too fast, please ask questions if you need to. So it really starts out with preconception, and then what do you feed your baby? And what we feed our babies here in this country are very different than what the rest of the world feeds their babies. Obviously, besides breast milk and formula, this is kind of what's in the formula. You can see American formula has typically almost always has gluten. It has pesticides, soy, mineral oil. It has genetically modified nutrients in it for sure, heavy metals. Europe and most of the rest of the world, it's all organic. A lot of times it's freeze-dried milk from other animals. It's gluten-free. It never has GMOs. It never has pesticides in it. It never has things because they don't allow it into their country. The rest of the world won't import our food because it sucks and it's full of poison. That's why we have so much more cancer than the rest of the world. Bottom line. So I encourage women to nurse if at all possible. There are over 280 different ingredients in mother's breast milk, and there's 45 in most formulas. So you cannot match that at all. Some women cannot produce breast milk. I understand that. Find donor breast milk. Use goat's milk. And if you have to, they have some, try to get like the highest quality formula that you can find that is organic, that does not contain dairy or soy or corn or rice. So it's challenging, but if you have questions, we can help you find some of those things. So it really starts off with your baby girls. Next, so what are some causes of poor breast health? Lots of them. Some things you may consider and are aware of, some things you may not know or consider or are aware of. So physically inactive. If you're inactive, your lymphatic system does not move. When your lymph system doesn't move, toxins can accumulate anywhere, especially in your breasts and your endocrine tissue. Medicine that you take creates a toxic load in your body, and your breast tissue is very sensitive to endocrine disruptors. Endocrine disruptors are chemicals that we find in our environment, that we smell in our water that we drink, and our food that we eat. So they're really everywhere. And when people have poor detoxification pathways, genetically, with MTHFR, MTRR, MAOA, and others, you just literally cannot get these things out of your body. So you have to take specifically methylated B vitamins, NAC glutathione to actually bind to and pull these things out. And breast cancer is not something that you do once. All cancer is an accumulative thing, a cumulative point in your entire body where basically your toxic bucket overflows, your immune system can no longer keep up with it, so the body then starts producing stem cells. Those stem cells accumulate in certain parts of your body, wherever the most inflammation is. So wherever your biggest chemical soup is, that's where the stem cells go, because that's a weakened part of your body. What weakens your body? All these things. Heavy metals, toxins, molds, nutritional deficiencies, processed foods, drugs, pesticides. Everything causes cancer. Some things we can't control, but a lot of things we can. So it's not something you should be afraid of. It's something you should be aware of, so you can prevent these things from happening to you as adults, and more importantly, your little girls. Because it starts off when they're young. So signs and symptoms of poor breast health is obviously pain. Your breast should not hurt. Even around your cycles, it's not normal for your breast to hurt. They should not be lumpy, bumpy. Well, they can be lumpy and bumpy, but they should not be pain. Fibrocystic breast tissue, if you've ever been told by a doctor you have that, is almost always a deficiency in iodine, which is most common in the middle part of this country because the ground does not have iodine in it, which is also where the majority of thyroid problems are also evident in the middle of the United States. Your breast should not be different sizes, different shapes, different colors. You should have no discharge, obviously, coming from your breast tissue. One should not be hot. Now, they might sag differently, and that's not that big a deal, but they shouldn't be abnormal. And you should be giving yourself regular breast exams so you kind of know what your normal is. It shouldn't be something weird that we can't talk about, especially with your young daughters as they mature through life. If you have unexplained weight loss and you don't know why, that could be a sign of something going on. Difficulty breathing can also be a possible sign. You just can't catch your breath because the breast tissue obviously is right by your lungs, and some of the cancer stem cells can actually permeate the lung epithelium and in between those rib muscles and cause difficulty breathing, and we kind of touched on the iodine piece already. So your teeth, interestingly enough, Dr. Thomas Rao did a study, and he found 150 women who had breast cancer, and they all had root canals. 147 of them had a root canal in the same tooth. That's clinically significant and should not be ignored. Ask your dentist, they've never probably heard of this before in their entire lives. And in your information we've given you, there should be a tooth chart that talks about which one it is. So 14, which is going to be towards the back. It's also going to be on 20 or 21, and you'll see it again 28, 29, and number 4. Now, will you have breast cancer if you have root canals in those teeth? No. Do you have a higher likelihood? Yes. So my patients ask me all the time, what should I do? Well, let's turn your body into a cancer killer so that you're not setting yourself up for failure because you didn't know, your dentist certainly didn't know, and it's not their fault. They just don't know these things because they're not taught that in school. Dentists get paid by doing procedures to take things out of your mouth. They don't get paid a bunch of money to clean your teeth. They get paid to do procedures. Just like all doctors. When you go to the GI tract doctor, what does he do? We gotta do a scope. Why not do a stool test? They don't make money doing that. They make money to do procedures that are almost always normal. I can go on, but I won't. What are endocrine disruptors? We kind of touched on that a little bit. They're everywhere. This vinyl flooring is outgassing. Sorry, I'm exposing you all to cancer. So is the paint. So is the drop ceiling. So is your car that you drove here in. So is your bed. So is everything. And if you're genetically predisposed to having these things, you're kind of behind the 8 ball if you don't know what you're doing. So you need to support methylation. It does over 500 different biochemical things in your body. So simply taking a methyl B vitamin that has methylfolate, methylcobalamin, that's B12 and folate, really amplifies your body's detoxification pathways. If your liver enzymes aren't working properly, if your alkaline phosphatase is elevated, those are some signs of some underlying problems. If your GGT is high, those are signs of having low glutathione. Your body needs that to pull these endocrine disruptors out of your system. And one of the biggest places we get the endocrine disruptors from is for the air we breathe. So I would suggest that people get air filters for their homes, if not one big one for a large area, individual ones that pull some of these things out, because it's there. My oldest daughter just had a grandson. He's 2 weeks and 3 days old, little Forrest. I bought a particle meter. Why would I buy a particle meter? Because he's going to crawl around on our carpet, and I want to know how many particles my carpet is outgassing. So here is different fluorocarbons than down on the carpet where he's going to be. And our carpet is low, and if it wasn't, I would have it torn out and put in hardwood floors. Ours is low, so it's fine. It's not outgassing benzene and their toxic fumes, but if it was, it would be gone. Because babies are on the floor. There's no problem up here, but there's a problem down there. These are all things that people don't think about. But when you start thinking about these endocrine disruptors, we've probably all heard of PBA free, and PBA we know causes cancer. But what about PBB and PBC and all these other things that are in plastic, that are in the soft plastic water bottles or baby formula bottles that you're heating up, that you're giving your kids, these plastic crinkly water bottles that make all the noise? All that plastic's in your food. All that plastic's in your water. So like the thin stainless steel is a good thing. It's like the hard plastic or the thin stainless steel that's light, or glass bottles that have a rubber coating on them is what you want to use for formula for little kids, because they're very susceptible to endocrine disruptors. Try to store your food in glass containers, metal containers. Don't use soft plastic. Don't put warm things in Ziploc bags, things like that. Those are all those. Again, it's not that you do it once; it's that you do it once a week for 50 years. That's the problem. There's all these things up. And then breast implants are a whole different topic. Think about a splinter in your breast that never goes away, and your splinter is this big, or this big, or this big, but depending on the size you get. Some women are fine; they have no issues at all. But I can't tell you how many women we've helped that were diagnosed with fibromyalgia, autoimmune conditions, and chronic fatigue syndrome. They wake up from their breast explants, their pain's gone, they have energy. It's like, I woke up and my body didn't hurt. I'm like, wow, there you go. You're welcome. The plastic surgeon, that can't be it. I'm like, really? They feel like crap with them in, they feel instantly better with them out. It's not a coincidence. It's a constant stress on your body. And there's the right ways to do that and wrong ways to do that. If you have questions about it, reach out to our office. I can tell you who to go to in Cincinnati, some of the people that are the best in the country, and how to clean up afterwards. That's really important, to get all the cytotoxins and the inflammatory mediators out of your system the appropriate way. Inflammation is pretty much the root cause of all disease. What causes inflammation? Everything. So how do you fix everything? You don't. You fix what you can control. So what can you control? What you breathe, get an air filter. What you drink, get a water filter, or you are the water filter. And what you eat. These foods we know cause inflammation. Gluten, dairy, peanuts, soy, canola oil, sugar, white potatoes, corn, alcohol. We know for a fact all of those things cause inflammation. So the more you can limit those things, the better. Now, does that mean you can never eat those things? No, you can, but be aware that inflammation weakens your immune system. So if you're giving your child a sugary cereal, well, that's sugar, gluten, dairy, maybe corn as well. Then they're going to preschool and they're getting goldfish crackers, all kinds of different colors. Well, that's gluten, MSG, food dye. Now they're having a peanut butter sandwich. That's gluten, sugar, corn, syrup, peanut butter. They come home, have a cheese stick, then they have milk to drink for dinner. They're inflamed all day long, every single day. That's why kids have diabetes. That's why kids have these autoimmune conditions that it took us 40 years as adults to develop. They're developing it by 12 because their bodies are so inflamed. When I grew up, there was like 3 kids who had asthma. There was no peanut-free zones in school cafeterias. We could bring snacks to class because everybody could eat them. Our kids are not healthier; they're sicker. Why? Because we, as their parents, consumed unhealthy food. We conceived them. Babies are born with 254 chemicals in their blood before they take their first breath. The odds are stacked against your kids. So now what we should do? We should vaccinate them. That's going to make them better. Whole another topic. So let's add more chemicals to their chemical soup. And then we're going to give them genetically modified food. Even better idea. Now we're giving food dye, which completely changes the structure of the food protein, which now causes food allergies, which then weakens your immune system, which then sets you up for cancer, and then the medical model makes more money. These other things cause inflammation as well. Underwire bra. Your breast can't breathe if there's underwire there. It cuts off the circulation. We have some pretty interesting pictures of the underwire bras leaving indents in women's skin. The toxins accumulate in your endocrine system more than anywhere else typically. so that's bad. Mammograms, 22 pounds of pressure. It's a lot. So you're damaging tissue, which hurts, and then we're gonna put radiation into damaged tissue on purpose, and your doctor's gonna recommend it because it's the standard of care. Standard of care is stupid in most cases. Some cases it's not. In some cases it is. In my opinion, this is one of them. Doppler thermography can identify things, cancer, way before mammograms. Now sometimes there's a time and place for them, so they're not all bad, but sometimes there's a time and place for them. But just to get them done, oh, you're that age now. It's time to increase your risk of breast cancer, thanks. No thank you. Obesity, the more body fat you have, the more inflamed your body is. And that body fat actually stores toxins as well. So when we detox people, it's important we give them binders and things to grab onto these toxins to get out, or just recirculating their system. A bad attitude, your emotions have a lot to do with your health. So it's important that you try to have a grateful attitude, because that really impacts the wellness of your brain and of your body and of your endocrine system. And then radiation, we talked about that already. We know radiation causes cancer. So does the medical industry. But apparently it's okay. But we have to damage your breast tissue first before we give you radiation. Genius. So what are some conditions that are common that you may have yourself or someone you know? Fibrocystic breast tissue, those are going to consist of tender cysts that are worse around your cycle when you drink caffeine. Talked about that. Oftentimes that's iodine deficiency. So a simple blood serum test shows you if you're iodine deficient. You cannot overdose on iodine. It's water soluble. You pee out what you don't need. So don't be afraid to take high doses of iodine. Now, high doses of iodine for a long time, maybe not the best idea, but for a few months, go ahead, not a problem at all. Fibroadenomas, they are non-cancerous tumors, which typically kind of come and go. They can enlarge and decrease as you age. So those aren't necessarily scary things, but those are some key things to kind of keep an eye on. Hormone dysregulation, so your breast will change in size and pain as your hormones fluctuate. But if your hormones are pretty well balanced, you don't really have a lot of tenderness, fluctuations in size and shape and weight throughout your menstrual cycle. So a little bit of discomfort is not abnormal, but pain is not normal. It's common, but not normal. I say that every single day. Common, but not normal. So that's something you always want to think about. Breast implant illness, talked about that. Toxic burdens, they're just everywhere. Skin conditions, obviously. Most commonly, we find skin conditions are an external portrayal of the internal condition of your body. So I am not a skin doctor in any way whatsoever, as I call it skin funk. Doc, I got this thing. I don't know what it is. Put some tea tree oil on it and see if it helps. If it does, it's some sort of contact dermatitis. If it's not, what do we do next? Do we send you to the dermatologist? Sometimes. Or do we think, what's going on with your body's immune system that's yelling at you through your skin? Oftentimes we see skin conditions are actually GI tract problems. So it's hyperpermeability or leaky gut that oftentimes shows or expresses itself on the skin. But you tell me, I don't have any GI tract problems, doc. I poop every day. I poop every 3 days. I don't have any GI tract problems. Well, normal is every time you eat, you poop. Like a big Play-Doh factory. Food goes in, food goes out. When that doesn't happen, that slows everything down here. So toxins sit in your gut, and the body wants to detox them. So how do we detox toxins? We detox toxins out through our skin. It's our biggest detoxification organ. But things that go out can also come in that same way. So it's very important that you use clean cosmetics. Don't get the cheap stuff from the cheap stores. Get the good brands. You need to buy, you need to invest in healthy skincare products, or just don't wear them at all, because it really is going to impact you as you age. Because there are all kinds of plastics and parabens and bad things in skincare. You can go to EWG, Environmental Working Group. They don't tell you what's the best. They tell you these are all ones being good. These are all 2s, 3s, 4s. and they give you a list. They're not saying this company is the best. They say get these and not those. Okay? And sensitivities. When you're sensitive to everything, you walk by Yankee Candle and get a headache. You smell cigarette smoke. You smell exhaust. Somebody's burning a candle. You may have multiple chemical sensitivity. So what does that mean? That means your toxic bucket is full. It's about to overflow. So everything bothers you. It's a big red flag for having really any sort of cancer. But since we're talking about breast cancer, we're talking about that specifically. So if you could have multiple chemical sensitivity, you must get an air filter for your home. Air Doctor is probably one of the better ones. It's more expensive, but you really are gonna pay. You are gonna get the quality that you pay for. So what is the solution? So I've kind of talked about bad things. So now let's talk about what's the solution to these things. Try to eat as much of an anti-inflammatory diet as you can. Oftentimes that's a paleo diet. What is paleo? What did we used to eat before we had farms? What we could kill, what we could gather. Because we didn't grow things. So it's fruits, vegetables, meat. Duh. We should eat fruits, vegetables, and meat. Well, that's sometimes inconvenient. And some people might even say it's expensive. But you're going to pay for it somewhere. You're going to pay for it at Kroger. Or you're going to pay for it with disease down the road. So you're going to pay for what you eat either now or later. So I think, especially if you have kids, you should invest in their health now to make them more resilient to all these conditions that their friends are getting because their parents don't know. It's not that they don't care, it's that they don't know. Eat as much organic, non-GMO food as you can afford. What supplements should I take? I don't know. Where should I get them from? Not the supermarket. Probably not Amazon either. So what's good about supplements is they're not FDA approved. Which is bad about supplements is they're not FDA approved. So the supplements we use here in our office are not FDA approved. I think one is. But they all go through third-party certifications that indicate and assay them. What we say is in them is actually in them. I recently saw a commercial for a grocery store that was talking about how their vitamins are GMP certified. I'm like, do you know what that means? That means their factory is clean. I'm glad their factory is clean. That's all it means. They were hanging their hat on the fact that their factory was clean. That's good. That's a great start. But what's in them? Oh, that doesn't matter. They're GMP certified. So you really need to talk to trusted practitioners that sell good, high-quality products because your supplements need to work. You're spending a lot of money on them, so they need to work. So we can utilize functional medicine testing. We can also use muscle testing to kind of ask the body what it needs. Thermography is a great idea for men and women both to see that the inflammation, which is where disease pretty much starts, is from the inflammatory process. Having a positive mental attitude is crucial to your overall health and being grateful for things. Complainers have health conditions. People who are grateful have less health conditions. So think about that. Reducing your toxic load in your home and your work and your environment is important. And exercise to whatever your tolerance is. For some people, running 5 miles is your exercise tolerance. For some people, a slow walk down the driveway is your exercise tolerance. But you must move your body to be well. It does so many physiological things for your mental health, for your cardiovascular health, for your lymphatic system to move. And if you just literally can't move, stretch. Engaging those stretch receptors in your muscles, extending those Golgi tendon organs, give you some benefit, not as much as exercise, but are better than doing nothing. And if you can't stretch, people can stretch you. So there's no excuse why you can't move or someone move you. Who can help? This guy? I can help. Debbie? She can help. People at Mindful Wellness, Jackie, can help. But the most important person that can help is really you. Because you're in charge of your healthcare. We just make recommendations. Your doctor's not in charge of your healthcare. You are. So you need to advocate for yourself and for your family, including your daughters. And if your doctor can't answer your question, they should say, I don't know, I'll get back to you. And if they don't, fire them and find one that can. If I can't answer your question, fire me. I know a lot, but sometimes I don't know things. So if I don't know things, I want to learn things. Because if you have a condition that I don't know about, I'm going to get more people who have that same condition after I learn about it. It's just the way the world works. So that's all I have for now. And I think Debbie is going to come up and talk to us next. She's going to explain kind of what she does and how she's an important part of our practice.
So what I do here at Sycamore Integrative Health, I do the muscle testing. I don't know if any of you have heard of muscle testing before, or nutritional response testing it's called. It's a non-invasive way of identifying which organ systems are weakened and why they're weakened. So Dr. Boynton talked about what happens when we are exposed to toxins and what we can do a little bit to prevent getting more and more toxins into us. But what I can help you with is learning what is your toxic load right now. The best way to be healthy, and that's the best way to keep for breast health, for overall health, and to keep your immune system strong, is to know what is your toxic load at this point. So through nutritional response testing or muscle testing, we can determine, do you have pathogens that are there that maybe you don't even know? A lot of people have parasites. We can determine that through muscle testing. We can find out, do you have latent viruses? Do you have fungus and yeast or molds that are affecting you? Do you have different bacterias? And then we can also check and find out if you have an overload of chemicals or metals in your body, and also find out if there are foods that are triggering a response in your body. So that is, and we do that through the muscle testing, but and then what we do is we recommend supplements then. So if you have an overload of chemicals, there are certain supplements that we know will help that. And once again, that all contributes to overall immune health, so that if you do have other things, maybe you aren't someone that can go out and get your root canals fixed, or it's very expensive. But if you know that is an issue for you, and you know that that you have some toxins there, then we can help you get rid of that, and we can help you be healthy, overall healthier. And it really is an amazing process. I'll tell you a quick story. I had a gentleman that came to see me from Northern Ohio, and he had been all over the place, literally to Ohio State and to a neurologist. And when he came to me, he was having episodes of large tremors. His body he would have large, not shakies, but large tremors, to the point that he would fall down. And they couldn't figure out what was going on. They did MRIs, they did muscle tests as far like EEGs, things like that. They did all that they knew to do, and they diagnosed him with functional movement disorder. So they kind of just threw him into a bucket because they didn't know what was going on. So he made his way down to see me, and Ohio State, by the way, their answer was that they were going to send someone to his home and teach him how to fall safely. That's what they were going, and they were going to teach his wife how to help pick him up. So to this day, I don't think they've heard from them to do that. But when he got here and I checked him, he had Lyme. So he had, through the muscle testing and through being able to detect that frequency of Lyme in his body, we were able to help him. And he was probably having, I think he told me 7 or 8 of these episodes every day. And when he came back for a recheck 2.5 weeks after we started him on a Lyme protocol, he told me that, I said, when did you have your last episode? And he and his wife looked at each other. They couldn't remember when. just in 2.5 weeks, giving his body exactly what it wanted and what it needed to heal. We were created to heal and restore our own body. And so once you do that, you know, if you cut your finger, you don't have to tell your finger to start healing. It just automatically starts healing. And that's the way we were made. So if you can identify pathogens or toxins that are within the body and help the body cleanse itself, then you are setting yourself up to be healthy adults, and especially with your children, to be healthy children. So that's about all I've got. I just wanted to explain to you a little bit about what I do, and if I can help anyone, you just let me know.
Have a look at your folders real quick, and just want to make sure you see everything in there that is in there. There's the little coupon right in the front there. This is we're approaching breast health awareness season, right? That's instead of calling it breast cancer awareness, we call it breast health awareness. And our biggest discounts are in October, so you can share this or use it for yourself. There's another coupon for TLC for healthy breasts. We're going to be talking about that very soon once we get this up and running. Then we have the PDFs, all of Dr. Boynton's presentation, which is awesome. A little bit about Debbie. Robin also sells Ruby Ribbon bras. Ruby Ribbon bras are great because they're kind of like Spanx for breasts, and they don't leave any lines. So we're going to talk more about that as far as bras go, but that's a great alternative. Certainly, if you've got underwire bras, don't even give them to Goodwill. You'll be passing on the badness of that. Just throw them away. We see, oftentimes in thermography, we see lots of inflammation right here where the wire ends, and our thermologist doctors often say that underwires tear up breast tissue. So there's nothing redeeming about them. Breasts do not need to be under our chins. That's not where they belong, and they're supposed to move. When they don't move, just like Dr. Boynton was saying, then there's no fluid exchange, and that's when we run into problems. So if the breast is standing in boob jail all day, not able to move at all, that just accumulates all kinds of toxins. Then you just have a good old-fashioned breast anatomy. Lots of people don't know there's a lot going on inside of the breast, and the lymph nodes, etc. A breast is a living organism that does a lot of things. There's a great article in here written by Dr. Boynton about implants. Implants are a real problem, and I hope that if you know anyone who's considering it, that you will have them read this article. There's nothing good about them, and there's breast implant illness, which is a real thing, and there's all kinds of resources now for explanting, which is what a woman needs to consider doing. And then we've got an article on dense breast tissue, and it's common, and the standard of care has done a really good job of scaring women into thinking that breast densities are a horrible thing. They're pretty normal, and it's like structures in your breast, but you'll read more about that. It's a good article. And then we got some suggested reading and essential oils that can be used for breast health. And I just have on my website now, I'm a big proponent of castor oil packs, and I'm an affiliate salesperson for Queen of Thrones, which they do castor oil packs. They also just came up with castor oil packs for breasts, something you would put in your bra. This is brand new, so I just looked at that and went, that is really cool. And you can use castor oil for breast massage as well. We're going to talk about that. Then we've got a little chart there on where breast cancer occurs, and most of the time it's up in here, in this area here. And there's a map here. Let's get the breast map here, right here. And this is a chart that you can use so that when you're doing your breast self-exam, you can chart areas that are sore, lumpy, bumpy, all of that type of thing, so that once you get into utilizing these breast care techniques, hopefully that will diminish over time. And then you have how to do a breast self-exam. which is super important to do that. It's so crucial that we are familiar with the terrain of our own breasts, because once something changes, then we go, that wasn't there before. And then we have some techniques there, and that's about it. Okay, any questions about that? Okay. TLC for healthy breasts. So these are the things that you can do at home to make sure that your breasts are being cared for as often as you can. I always say that the best time to do breast massage, even just for a minute or two, is right when you take your bra off. And Robin's going to talk more about that, but when you take your bra off, there should be no red marks or divots, period. And if there are, it's just too tight. So when you come home, first thing you do is you take your bra off and just massage your breasts for a minute or two, okay? And if you feel this warm, tingly feeling in your breast and your chest, that's actually blood rushing back into your breasts after having been starved all day of breast and lymphatic fluid. So it's super important to do that. Just walking around without a bra on is also super healthy, because even though it might be uncomfortable for very large-breasted women, but just that normal jiggling and wiggling around, that's what they're supposed to do. Have that fluid exchange, that movement for lymphatics. Okay, so let's go. In this document here, and this is something that I'll tell you about later if you want to purchase it, you'll find proper techniques for massaging your breasts, pictures showing you how, written instructions how and why breast helps with your lymphatic system. Okay, so we're going to walk you through this. So she is laying on a pillow, so like on a flat, which is because she's her. This is my daughter. She agreed to model for this, so this is my wonderful, beautiful daughter. So laying on a pillow placed under your back, between your glutes and your back, bring your arms up and over your head. Hold and then stretch further as release happens. Hold for 2 to 3 minutes if desired. You could then move your arms out to the sides, feeling for any areas that need to be released. So if you come to an area that's stuck, that's where you hang out. You never go to the point of pain. Back off a little bit, wait for that release, and then go deeper. That's kind of the rule of thumb for this whole thing. Sitting or lying down, pancake your breasts with firm pressure. This shouldn't hurt. So I'm pushing, and I'm pushing probably as hard as I can. It shouldn't hurt. If it did, you back off a little bit, wait for that release, and then go in a little bit deeper. Okay? And you can do this standing or sitting. The breast jiggle. It's always about movement, right? So I have no fingernails because I'm a massage therapist. So if you've got fingernails, you're just going to have to be very careful. And you're going to put your fingers like that, and put them pretty much at your nipples and just jiggle in all the different ways. There's a lot of, for a lot of women, there's soreness around the nipples. We want to clear that congestion out. So just doing that for 2 or 3 minutes. Be sure you don't want to slide on the skin. It's engage and jiggle like that. Okay? Then we have lift and separate. It's pretty self-explanatory. So sitting or lying down, hold the breasts firmly on the medial, middle sides. Gently traction the breasts in opposite directions. This can help release restriction caused by bras because they're being squished together all day, right? Now we're reminding them they can actually go this way as well. Hold for 2 to 3 minutes. And you can, anytime you're doing this, if you feel an area of restriction or discomfort, that's where you want to hang out. And you'll probably notice over time that that gets easier because you're slowly releasing all of these tiny little adhesions. That's the goal, as well as fluid exchange. Rib cage and breast release. So you're gonna hold your skin here and you're tractioning down without sliding on the skin. And then you're cupping your breasts like that. And then the idea is you're kind of separating that way, slowly, without sliding, and just waiting for little releases. And you'll feel them. You'll get better and better at it all the time. But you just feel like, oh yeah, okay. And then of course you're going to do the other side as well. All right. Now this one looks a little horrific, but it's not as bad as it looks. You're basically, and if it's like I said earlier, for the nipples, it can be super tender. So you're only gonna do what your nipple will withstand. You might have to start really slow, and that's fine. You're just gonna grab your nipples gently and traction out. And if they're super sore, do one at a time. So you can really tune in to that breast, that nipple, and just it's gonna talk to you. And it's gonna say yes or no, or back off a little bit, and then be sure to do on the other side as well. And this might take a long time to get to the point where you can pull out that far. Now, she went pretty far, right? And that's great. Okay, lifting and releasing. These are the same position. One is sitting, one is lying down. So cup your breast with both hands. Right at the base, the intention is to gently lift the breast away from the rib cage. So we're going this way, okay? And then your grip shouldn't slide. Hold for 2 to 3 minutes. And then you can very gently and gradually shift the breast to different positions, like different positions on the clock. You can go this way, 1, 2, all the way around the clock. You don't have to do it every time. Just play with it. Just get used to releasing restrictions as you come across them. Breast and armpit release, holding the breast in place. Slowly raise the arm up and away from the body just until you feel a boundary. Then try stretching a little further once you feel a release. Of course, you would do it on the other side as well. That actually feels really good as well. Okay, so this one, you're going to hold the top of one breast down while gently turning your head in the opposite direction, placing your hand on your cheek. Slowly add pressure to traction a little bit more to make the stretch even deeper. That's a good one as well. You can feel that in your neck. So cupping, and you all have one that you can take home. Some of you have pink, some of you have blue, so you can use the blue one on your boy breast, and you can use one on your girl breast. And how does a cup work? Have you guys ever seen cups before? Basically it's squeeze and put it on the skin, and it just pulls. It separates the tissue. It pulls lymphatic fluid, etc. And this is something that you learn over time. When you're doing it on breast tissue, you want some lubrication of some sort. Okay, and then you would. It's harder to show, and then you would slide like that. You hear the little, yeah. And I'm going to show you how to do that, not on me, but I'm going to show you how to do it at home. It's really, really effective at moving things along. Okay, here we go. Even at different times of the month, it's always a good idea to be able to recognize familiar lumps and bumps. When you start doing regular breast massage and cupping, etc., a lot of those bumps and lumps will go away, because your body is processing them because they're getting pushed out. It's kind of like, I kind of think of it as a, what's that weed called? It's everywhere. I can't think of it. It's like a bush.
Honeysuckle.
Honeysuckle, thank you. So if you've got a patch of honeysuckle that's really dense, there's no air movement, there's no water, nothing's getting through. It's all congested, right? Now you've got someone who goes in and starts getting rid of all of that honeysuckle and clears the way. That makes such a huge difference, right? You get the wind moving things through, you've got the rain, you get the sunshine. That's what we're going for. So between the massage and the cupping, we're just, you're basically cleaning your breast tissue. That's basically what you're doing. All right. So this is a wonderful way to stimulate lymphatic flow within your breast. Do this 1 to 2 times per week. Put your hand in the opposite armpit to start out and pump. Do that 5 or 6 times. Anytime you're going to start with breast massage, I think it's a good idea to do this pump. And then you're going to use your hand from the opposite side that you're massaging or cupping to lift or hold the breast up that you're about to work on with a small to medium cup. Using very light suction, follow the patterns that are illustrated, starting at the center of the chest, cup several times under the breast in the direction shown, all the way up to the armpit. So we're going to start here, and go like that. And you can play with what feels better for you. And you'll get better at this. This takes a while. And if you never get the hang of it, then just throw it away and just use your hands like that, okay? And then the next one is with your breast up a bit, I'm gonna cup down like that. If you can't use the cup, a good place to do this is in the shower. If you've got a nice organic body wash, great place to do that, or just use your hand. If you don't want to be bothered with this, that's perfectly fine. And then the other directions are up towards the armpit, up towards the collarbone. Okay, easy peasy. You get better at it. Okay, and if you wanted to purchase it, there's a way, and you've got a coupon in your booklet. And then be sure to like us on Facebook, because you're going to get all kinds of tidbits and breast health, and we do post all the time for that. And you know, if you do nothing else, I show people this all the time. If you take your bra off, you've only got a minute, and you just want to do something because that bra has just been killing you all day, then do the pumps, do do a few pumps on this side, pump on this side, massage your breasts for 30 seconds. Then take the webbing of your index finger and thumb and scoop up a few times like that, scoop up a few times like that, then finish with the pump again. It's 4 steps, maybe takes you a minute. If you got in the habit of doing that, if you take a daily shower, do that. Just do something. Something's better than nothing at all. Okay, any questions about breast massage, anything like that? No, we're all good? So if you do, I think you all know how to contact Robin and me. Don't hesitate. That's what we live for, truly. Okay, Robin, it's all yours. We like to see women start doing thermography by the age of 20, because we already start seeing, we actually, thank goodness not for us, but we found an 11-year-old with breast cancer once, which was horrific. But the earlier we start monitoring for abnormalities, it's the abnormalities that we can find that other testing cannot. So if we're, the goal here, and I don't want to be stealing Robin's thunder here, we are not going for early detection. We are going for prevention. We don't want to be looking for an already established mass. We want to get it. There we go. Thank you. We want to get it before that, so that you can, when there's something different, you can go see your functional medicine person and start with lifestyle changes. Lifestyle changes are almost always what's going to reverse this abnormality from becoming a pathology. And that's what we're going for, right? And that's what we want for our daughters and our friends and our mothers and our grandmothers, all of it.
Hi, ladies. Okay. Thanks for coming in. I'm Robin. I work with Jackie. I am her mobile unit, so I get to travel around to different locations to do thermography. So Jackie has her bricks and mortar in Westchester, and I have 7 to 8 locations, anywhere from Fort Wright, Kentucky, all the way up to Tip City and Vandalia area, and some in between. So, and some on the east side. Actually, we're looking for a place on the west side of Cincinnati. So if you guys know anybody who might be interested in being able to have us come into their office, we would love that. So there's Jackie. She's already introduced herself. There's me. We're both massage therapists, both certified thermography technicians. I have been doing thermography with Jackie for about 5 years now. Mm-hmm. Yep. It kind of came to me via her, just kind of out of conversation, really. I wasn't looking for something, and I was, as a massage therapist and a certified health coach, I was kind of busy helping people keep the inflammation down. And the more I thought about this really made sense to me. Now I can detect it, so that what are our next steps, so we can help people reduce that inflammation even more. So has anybody ever heard of thermography before? Yep, very familiar. Has anybody ever had thermography done? Okay, a couple of you, great. What we do is we use an infrared camera to detect heat and inflammation in the body. Being inflammation, like Dr. Boynton said, is the root cause of all disease in the body. So be able to see that before it becomes a pain or a symptom. We look at it as trying to be proactive about your health instead of reactive about your sickness. It is radiation free. I'm going to kind of talk a little bit about the difference between mammograms and ultrasound. So I'm going to kind of be jumping back and forth here a little bit, but with thermography, we use that infrared camera. You're standing in front of it. There is no compression. There's no contact. There is no radiation. Very simple to do. And like they said, and Dr. Boynton and Jackie both said that we can detect inflammation, all different breast types, sizes, even with implants, which I will show you an image here shortly, with thermography and implants. Now there's over 4,000 articles and research is done on thermography, and over 800 of them alone are on breast thermography alone. So we see more than just breasts. We do what we call breast, what we call head and shoulders, or head and torso, excuse me, or full body. So we can see things like potential blocked carotids. Oral inflammation, as they talked about, is a huge one. We've seen it bathe the thyroid, go down into the lymphatic channels into the breast tissue. We've seen TMJ, sinus issues, hormone imbalances, veins and viscosities. Now people ask me, can we go deep into the bone or into the organs? We cannot. We see from a superficial standpoint. But if there's an organ inflamed, like the liver as an example, that inflammation is going to come to the surface and show that there's something going on from a heat perspective that we want to further investigate. Now, I'm sure every one of you has known somebody, a woman, and some men actually, who've had breast cancer, right? I'm sure everybody's known somebody. I have a very dear friend who had 2 mammograms and an ultrasound, and they said, "You're fine, we'll see you in a year." And she says, "Nope, I can feel it, there's something going on." Came in for a thermography scan and came back highly suspicious. Sent her back off, and if I'm not mistaken, she did an MRI, another mammogram, and came back as 3rd stage lobular and ductal carcinoma. What if she would have waited that year? So the difference between mammograms and ultrasounds is we can see inflammation and heat. Cancer needs a blood supply, creates heat, it gets hot. So that's how we can see things potentially sooner than other screenings. With mammograms, they're looking for already established densities. I want to say about 65 to 70% of women have dense breasts. So it's harder to see what's going on in the dense breast tissue. Now a lot of women will say, well, I get that 3D mammogram. Well, they use 1.5 to 3 times more radiation when they do that, and they're supposed to let you know that as well. So what that does is basically it's taking the images and slicing the breast in image form. A density is a density all day long, no matter how you slice it, no pun intended, but it can still look dense. Now there was a law put into effect in 2015 called the Dense Breast Tissue Law. If I'm not mistaken, it's in about 37 states, stating if your healthcare provider suspects you have dense breasts, they have to let you know that mammography is not the best screening, because what I just explained is cancer can look dense in a dense breast tissue as well. Now here's just kind of some examples of what the different types of screenings. We've got the upper left is the mammogram, down below is the ultrasound, and then we've got the MRI to the right and the thermography to the bottom right. So it kind of gives you an idea of the different types of screenings. And I always tell women, doesn't matter what screening you get, it's a diagnostic tool. It cannot diagnose. Only a biopsy would give you the true diagnosis. Now what we do is if there's something that we suspect that's much higher than temperature threshold, because we have different temperature thresholds that our doctors look at, there's about 8 to 10 of them alone just in the breast tissue. So as an example, I don't know the numbers per se, but let's say the nipple area is 0.3. And your right nipple area is within range, but your left nipple area is like 3.68. There's something going on there from a heat perspective that we want to further investigate. And our doctors normally will say, let's go ahead and just do an ultrasound to correlate it. It's kind of like a second opinion from a different perspective. Is it seeing what we're seeing from its perspective? If it is, what are the next steps, right? Mammograms basically do the same thing. They'll go to an ultrasound. Now we're going to kind of cover a little bit about what the images look like. This is the same person. We take it in the far right. It's called inverse grayscale, and we do that so we can see the veins and viscosity so much better. And then our doctors will turn it into the color palette based on the heat differentials going on. If you look at this one, there's something questionable on that right breast. excessive toxins and hormones can cause disruption in the breast tissue. And this person, if I'm not mistaken, did some further testing and it was breast cancer for her. Now people tell me or ask me when I'm doing the scans, can you see anything? Well, I'm not, that's out of my scope of practice to be able to say, yeah, I don't know what that is, or that could be something. There are times where I've seen things, even in mine, going, that doesn't look right, but it was fine, and then vice versa. So there's where our doctors come in. We work with Breast Thermography International. We have at least 3 levels of interpretation that your scans go through. So you have at least 3 doctors, thermologists, looking at your scans. They're going to turn it into the color palette based on the heat differentials going on, and then they'll do their thing, and then you'll get your results and report back. You get your images, your black and white, your color, and then a written report for each section. And we also have a 15-minute phone consult that we recommend that you do. It's kind of, was recommended about a year and a half ago. We made it kind of part of the scan because there were women that weren't taking the recommendation to get the consult done, and they would come back 6 months to a year, and what was of concern from our perspective had gotten worse. So we make sure that we are giving all that information to our patients and having that consultation with our doctors so they can go over the thermographic results with you, and then what are your next steps. Now, we talked a little bit about implants and how they're not good, right? I know a couple women who've had breast implant illness from their implants. They've since had them out. Some have returned to normal relatively quickly. Some are taking a little bit longer depending on how long they've had them and what dis-ease was disrupting the body from those implants. If you look here, this woman, she had a mammogram done. A lot of women who get implants don't want to have mammograms because of the pressure put on that implant along with breast tissue, the muscle. If you can see this little arrow right here, it's probably kind of hard to see. That shows after the mammogram, they came in for a thermography scan, and you could tell that that breast implant had ruptured. You couldn't see it or feel it. She didn't know that that was there, but that's one thing that thermography can potentially see for women. So that, what can we do to get that out, right? So it doesn't progress and make her sick. Now this shows advanced stages of cancer. This is the same person. These are her black and white and her color here, and then 6 months later. They were about 6 months, and they showed, you can see, people always say, what's the colors mean? Red and yellow obviously mean a little bit warmer. There's some more heat there, but you can see the difference between this one and 6 months later, how that cancer is advancing. So this is a great tool to use to map, measure, and monitor what's going on in the body from an inflammation standpoint. We do have patients who have been diagnosed with cancer, and they come in to see us and monitor their cancer, which I'm going to show you here in another slide or two, how we can see if that cancer treatment is working for them. Now this is inflammatory breast cancer. This patient decided to try alternative treatment, which totally up to them how they want to treat their dis-ease in their body. They went, I think they went to Spain for their treatment. But if you can see, this is kind of hard to tell. The top one is February 2012. They came back May 2012, and you can see that right breast, how it's getting hotter. The cancer is growing. This is July, the third one, and then September, how it's invaded the armpit all the way through the whole breast and starting to go into the underside of the left breast. Unfortunately, this patient passed away in January of 2013. What if? What if this patient had decided at that second thermography scan, okay, I see it's getting worse. Maybe I need to get that mastectomy done. And then decide what she wants to do. If she wants to go allopathic or holistic, she may be here to tell her story. And real quick, my good friend who was diagnosed with stage 3 through thermography, she had 1 round of chemo. It put her in the hospital and took her hair, 1 round of chemo. Almost killed her. And she decided, I am not going to go that route. And that was her choice. She decided to do it very holistically. She is almost 8 years, if not 8 years, cancer-free. So it can be done. Your body's meant to heal. You just have to give it the right tools, the right information, the right people who know how to help on that end. She has since gone back to school. She was a certified integrative health coach prior to this. And then she went back to be a certified cancer coach. So she deals with women during their cancer diagnosis and help them through that as well. Now the next one. They both talked about bras. I'm going to talk a little bit about bras. Is your bra too tight? When you girls go home tonight, I want you to take your bra off, look in the mirror, and if there's any red marks anywhere, your bra is too tight. Obviously, we can adjust the straps, right? But if the band is too tight, you can go out and you can get the band extenders. But if it's an underwire, you need to get rid of it. Because the underwire, the way it sits, it puts pressure on the lymphatic system. It causes constriction of the blood flow to the breast tissue. That's precious tissue that we don't want to cut off the blood supply to. We've seen, I know I have, and I know Jackie's seen even more. You know where the underwire stops usually on that bra? We've seen marks in the breast tissue from that wire. And that's breaking down the breast tissue. It's causing disease over time. So that's your homework for this evening. You're going to go home and see if they're too tight. Now with that said, people say, well, I don't wear underwire. Well, it goes for all bras. If they're too tight, they can cause dis-ease of the body over time. Here's one, and it's more of a sports bra kind of thing. You know, that's great. We need those sports bras if we're going to work out, right? Because we need those girls to stay where they need to be while we're working out. We just don't want to wear them all day long. And God forbid you wear a bra to bed. If you have any young girls in the family and they're starting to develop, they're very self-conscious. My daughter was one of them. She wore bras to bed. It's one of the worst things that girls can do. Let the skin, let the breast breathe. Very, very important. So this is causing some congestion and inflammation around the breast tissue. And not only that, is around the back as well. All right, so we've talked a lot about breasts, but what else can thermography see? We can see a lot more than just breast health. Dental issues. They both talked a little bit about dentists and teeth and root canals and mercury fillings. It is so important to keep the health of your mouth very good, because if it gets the gingivitis, the root canals, the mercury fillings, you're off-gassing every time you chew down on a mercury filling if you have not had them replaced. And that can cause disease over time. We've seen oral inflammation leach down and just bathe that thyroid. And then you wonder, the women who are dealing with thyroid issues and maybe on thyroid medication, is it truly thyroid issues? Or is there some oral inflammation contributing to that? You know, what is the root cause of the thyroid issue? If you can see this one, probably can't. There's little arrows coming down, and this doesn't have a little light guide. It's coming down right through here into the breast tissue. And Dr. Boynton talked about certain teeth representing meridians and representing body parts. I had a patient who I still see. We monitor her through her cancer treatment. And this tooth that's representing that breast was a failed root canal 8 years prior to her diagnosis. She figured this out before she came to see us. So she realized that that root canal potentially caused that breast cancer. So we monitor her, and she's doing really well. There's a picture of what it looks like when the oral inflammation is bathing the thyroid. Now here's a picture. You can see a side profile of oral inflammation. See the redness around her jaw, around her chin? That's post root canal, and she has no symptoms. So thermography is a great way to see what's going on there as well. So we've had people who, from our first thermography scan, they've had a lot of oral inflammation. They've since gone and had the work done, whether it was root canal, taking those out, taking the mercury fillings out, and then they'll come back and they'll get scanned again to see if the inflammation is reducing. And I've had several patients that are like night and day. I had a friend, who had 13 mercury fillings that she had out. And she says, it felt like a new woman. I mean, she was sick, she was just not quite feeling right, had those mercury fillings out, and she's like a brand new person. So now, skin cancers. This person came in for a thermography scan, and you can see it's between her shoulder blades. It's pretty big. So that's showing some abnormal inflammation going on. She went to her dermatologist, was tested, and it was skin cancer. She couldn't see it or feel it on the skin. It's one of those things where sometimes you can see, my husband's had skin cancer on his nose and you can see it. She didn't even know that existed. But through thermography, because it's creating heat, we seen that there was something going on that made her further investigate it. Now, severe inflammation with full body thermographies can show inflammation of the abdomen if it's coming to the surface. You guys want to take a guess at what's going on with this gentleman over here? You can see he's kind of red up in the head, down through the mouth, down to the right side of the axillary armpit and into the right side. You guys want to take a guess at what that could be? Alcoholism. Kind of interesting, huh? And then there's something going on up here. Could be liver, could be a variety of things. We can't diagnose, but we can see something going on from that inflammation standpoint for that patient to go ahead and further investigate it to see what is going on. They may not even know it's there. Now this is a patient. You can see how inflamed the spine is. This is great for a chiropractor to see. I always tell my patients, if you have a lot of inflammation in the spine and you're seeing a chiropractor or a massage therapist, for them to be able to see these scans helps them to create a treatment plan and protocol. They have a better understanding. Because usually it's three things. It's subluxation, your vertebrae are out of alignment, it's muscle pulling you out of alignment, because all the muscles from the back of your head down to your tailbone are all connected to your vertebrae in one form or another. Or there's inflammation there that you can't see or feel. So this person came in and was getting scanned, was getting an adjustment a week for 12 weeks. And about every 3 weeks was getting scanned to see if the treatment plan was working. And you can see the reduction of the inflammation, which is pretty cool. And here's one tracking treatment processes. This was over about a 6-week period from March of 2012 to about May of 2012. So about every 7 to 10 days was coming in to get scanned to see if her cancer treatment was reducing the inflammation in the cancer. And you can see that it was working. And then hormone imbalances. I'm sure most of us have been through some kind of hormone imbalance at some point, right? Peri, post, menopause. What's kind of funny about this is we call this leopard prints. So if you look like a leopard print to us, that's indication that there's some hormone imbalances going on. And if you don't know, then you can take it to your functional medicine doctor, your doctor, whoever you're dealing with for your hormones, have them tested to see where you're at so then you can get balanced. And then again, this is another one just showing how lifestyle changes can reduce inflammation over time, and we can map, measure, and monitor that. There was something going up with them that left breast, made some lifestyle changes, came back about 6 months later, and you can see it was reduced. People always ask me, so how much does it cost? What's the price? Well, we have the 3 different scans. The breast scan is 6 images. That's both breasts, underneath, above, in between the armpit. That's $299, and all these scans, do include the 15-minute phone consult with one of our interpreting doctors. Then we have the head and torso. That's everything from about here to here. Includes the breast. That's about 18 images, and that's $399. So for $100 more, you're getting so much more looked at. I always tell women you're more than just your breasts. Above and below, as we can see in some of these images, can contribute to breast health or lack thereof. Then we have full body, which is $549, and that's about 25 to 27 images. Even includes the bottoms of your feet, and your bottoms of your feet can tell a lot. And then I threw this in here. This is last year's, but this is come October, we are having our Breast Health Awareness Month. It's our month that we try to educate and give the biggest discounts for thermography. So we're going to honor this today. If you guys get signed up and call us between now and October and let us know that you were here or you've seen us online, we're going to give you the deepest discounts, which is $25 off a breast, $35 off a head and torso, and $50 off full body. So that is about it. I have mobile locations: Fort Wright, Eastgate. I also have a Westchester, Springboro, Centerville, Tip City, and Versailles. So if you know anybody in those areas that might be interested in something like this, you can just pass that information on to them as well. Jackie and I have had people drive 4 or 5 hours to come see us because we're the only ones in this area. Kentucky, there isn't anybody in Indiana that I'm aware of, because I just had somebody come a 2-hour drive to see me a couple weeks ago. So that's about it. Any questions? Yes, ma'am.
How often do you recommend having thermography screening? Is every year or?
Normally, let's say you had your scan today, and there is something that our doctors are questioning from a temperature perspective. They may want to incorporate an ultrasound. Let's say you get a full body done today to see what your overall thermographic load is, and then from there you may need that ultrasound. And then 6 months later, our doctors usually ask you to come back just for the breast, so we can really stay on top of measuring, monitoring with breast tissue, because so many things can contribute to changes in inflammation of breast tissue. And normally it's like a year out. So I have some people who come in for the full body, and then they've got some issues going on with maybe hormones or thyroid. They'll come back 6 months later and do the head and torso, because they want to see if what they're doing, lifestyle changes or whatever, is working, and then they go from there. And inflammation's always ever changing, but we want to focus on the areas that are really of concern so we can get that to reduce. Again, being proactive instead of reactive, right? Yeah. Any other questions? All right. You did mention Ruby Ribbon a little bit. So there are some bras. During this whole pandemic, when we were all home, I was playing around and buying all kinds of different bras. I had nothing better to do, right? And trying them out, because I struggled to let go of my underwire bra, to be honest with you. I've known for years not to wear one, and I gave it up a couple years ago. And then I found a company called Ruby Ribbon, which is kind of a braless bra. It gives you that support, especially if you're very well-endowed women. You struggle to find something that's going to give you that support. They have 5 different levels, and I've got some here that you can look at, and we can go from there if you have any questions. But I really like them just because I don't want to feel like I'm wearing a bra. And I always tell women, when you're home, take the bras off. Make sure you're just walking around. Have a shirt on, unless you're home by yourself. But you don't wear a bra at home. Let the girls free, so to speak. You know, people say, well, I can't do that. It's like, yes, you can. Yes, you can. They will thank you for it. But when you do need that bra, my favorite is the levels 2 and 3. The 4 and 5 get a little bit more structure in tummy control, back support, a higher lift. So I've got some images on my Facebook page of women who are very well endowed before and after with their old bras versus their Ruby Ribbons. So anyways, you can take a look at those and I can answer any questions. If you find another one that works for you at a store or online, please let me know, because I'm always looking. Not everybody likes what I like, but yeah, that's it.